Hello, Miss Cargo. How are you today?
I'm doing very well.
Thank you.
for asking.
All right.
How are you?
I'm doing well. Thank you for meeting with me to do this interview. This interview is about my nursing 490 class. I want to have your permission to do this interview, as this interview will be for my 490 course, nursing 490 course. I have like 3 questions to ask you, and this is about leadership role, your leadership role. Can you please tell me what kind of job you do?
Of course. First of all, I want to thank you for interviewing me, and I want to tell you that I'm delighted to be a part of your
Thank you
course.
very much. Thank you.
So you asked me what kind of work I do. I'm a nurse practitioner. I'm an acute care nurse practitioner practicing currently I work at a hospital setting, and I work mostly on the surgical floor, and I take care of post-op patients. My job involves patient flow. I do clinical work. I take care of the patients after surgery and up until their discharge. So basically, I am a go-between between the physicians and the nurses. And in my role, I see a lot of interdisciplinary work. I coordinate things with the physical therapists, nutritionists, housekeeping, and I'm very delighted to be part of a great team where I work.
Thank you. Excellent. And thanks for that introduction. So we'll go right into the question. The first question I would like to ask you is that, what do you think that you can do in your leadership role to empower others
What do I think?
as a leader? Yes.
That's a very good question. I think we can start by defining who a leader is.
Yes.
I believe a leader is somebody who takes ownership of what they do, who feels they are accountable for what happens, the outcomes of whatever they get involved in. And needless to say, you cannot be a true leader without a good following. If you have a good team behind you, then you can absolutely lead, because this line of work, it's all about teamwork. Yes, you can have an appointed leader. Maybe you can have more skills, more education. That could be what would define you as a leader, but you do need a good following. You need a formidable team to have that. Now, as far as what do I do to empower people I work with, first of all, I think everybody's got potential. Now, once you realize that the people you work with feel comfortable with you, then they can be a part of what you do and follow the organization's model. So as far as empowering people, you have to realize that people need to feel comfortable with you. When people feel comfortable with you, they come up to you with any kind of questions. They'll tell me, Mahawa, this is a dumb question, but I'm going to ask it. So that tells me they have confidence that I'm not going to laugh in their face, so I'm not going to belittle them. Yes. I'm not going to go back and just say something that would embarrass them or put them in an awkward position.
Yes.
So there and then, you just make people feel comfortable with you, and that can empower them.
Yes.
Also, you also have to make sure that you understand how to communicate well with people. Communication is the essence of what we do, both body language as well as verbal.
Yes.
Now, you have to understand that the nonverbal cues are like 80% of the communication. People don't even have to hear what you say. It's the way you express yourself. Okay?
Yes.
Once you express yourself in a way that people can understand, that empowers them a lot to be able to feel like they're having an open dialogue, an open conversation. So good communication is very empowering, both to the audience as well as to whoever has a table. So that's another way we can empower people around us. Another way we could do it is to make sure that they feel like they belong.
Yes.
Now, everybody's input is very important.
Yes.
If the tech comes and tells me that the patient's leg is swollen, I take that information very seriously, and they feel very empowered.
Yes.
So when they come to me next time, They realize that if there's bleeding, they're not hesitant to tell me because I didn't make them feel like the information they gave me in the past was non-essential. So empowering people, you have to make them feel very important. You have to make them feel like whatever they have to contribute is of the essence.
Right.
So you got to make people feel that they're part of a team. Every piece of information, every act of kindness that they render is very important.
Yes.
So I believe those are ways that we can empower people.
Wonderful, wonderful. You touch on some of the most important things about empowerment. So, and one you mentioned was communication and making sure that every part of the team is considered very important.
Absolutely.
And their communication and the information they have to convey is very important. Thank you. That's a very empowering message. So my next question to you, Ms. Cabell, is that what are your personal leadership strengths? I know every leader has their own personal strength. So what can you tell me about that?
I think personal leadership strengths involve a lot of humility. You have to be very humble.
Yes.
You know, you have to appreciate everybody. Okay? Now, again, I know I said this before, but everybody needs to feel important. Okay?
Yes.
When you tell people or make them feel like they matter, that's a great leadership strength. Okay? Another thing is being non-judgmental is very important as a leader also, because if somebody tells you something, or you go in a patient's room, for instance, I mean, when you walk in, you see certain things that might make you just either doubt the patient's aptitude, or even just make you wonder if they really are going to understand this teaching or whatever you're trying to tell them. So it's very important to not be judgmental or come up to some biases just by looking at the first picture. So as far as making sure that you're not, okay. So as far as leadership skills, you have to also make sure that you realize that you're not, as a leader, you don't have all the answers.
True.
You are counting other people with experience, with expertise, as well as you're counting on the people that work around you. A good leader does not have all the answers, but they have the way to point people to the right people and to give people the cues as to where to get the answers from. It's funny you ask this question because a lot of times people run up to me and think I have the answers for everything. So most times, for the most part, I have the answers. For the times that I don't, I just make it as a learning moment for everybody, as a teaching moment. And we can look stuff up, or we can go search around and come up with the right answers, and we all just benefit from that. So another good leadership skill that I found that has helped me a lot in my career is the knowledge and the fact that you appreciate that you're always learning. You're always willing to learn, and it's also important not just to learn and save it for your own edification, but you also are willing to share what you learn and to put it into practice. Say like going into conferences, you bring new ideas, put them into practice. It just all around just makes the whole patient experience an absolute friendly and fulfilling experience.
Wonderful, wonderful. You do show the a very good trait for a servant leader. One thing I took out of what you said was that a leader doesn't always know everything, and even the leader is in a learning process. You learn as you go along, even with the ones the ones that are your staff. that you lead, you learn with them, because every patient has their own different, unique needs, and so you learn from the patients as well. Thank you for that answer.
You're very welcome.
Very nice answer. My last question to you is that do you allow for staff members to meet their full potential? I know you started to talk about that earlier, but if so, how do you accomplish that goal of allowing your staff to meet their full potential?
I'm really glad you asked this question because I take this as an opportunity to actually express a certain sentiment that I have about my personal nursing career. Now, just to digress a little bit, when I started my nursing career, I was a nursing assistant, and I had a nursing manager who had a lot of confidence in me. For some reason, she saw something in me that I never knew I had. She told me one day, she pulled me to the side and she said, Mahawa, for you, nursing is not just a job, it's a career. So I was pretty amazed, and for the past 10 to 15 years, those words have just like carried me along in this whole journey. Now this nursing director saw something in me that I never knew or nobody else around me saw. So talking about the word potential, she saw potential in me. And those words literally just guided my whole career. So every time I go to the next step, I think about what she said, and I realize that I have to keep going in nursing. I have to keep going in nursing. And to this day, 15 years later, I still think of this lady and I appreciate her. So now to answer your question, how do I encourage people to become what they can and to develop or be their best at their potential? First off, everybody has different talents.
Yes.
Everybody has different skills. Everybody has different personalities. So what I try to do and what has really helped me is to realize and understand the people I work around. Now, once I realize that certain traits will actually work better in a certain scenario, then we try to incorporate that in what we do with our patients. Now, if somebody, for instance, is very calm, of course, we don't put a person who is very anxious and stressed out in a certain situation with a certain patient who's anxious or stressed out. So personality traits you have to actually identify so you can mix and match and get good outcomes with the patient. Now, not trying to say that we just judge people and say, forget you, we can't have you in this team. The point I'm trying to make is you make people use the best out of them. Now you make people realize what they're good at and how they can use what's good in them. So how do you encourage people to use their best potential? You encourage and you tap on the good. You encourage their insight. You encourage their talent. You encourage them and realize that it's okay to make mistakes, you know. It's okay to falter. I always tell my patients, my nurses, if nobody dies, then we're doing okay. This is a learning experience for us. So they're not scared, they're not worried, they're not afraid to move on to the next patient. They're not afraid to take on that next task. Okay, so you tap into their potential. You always commend good behavior. When we falter, we all go down together. I tell them if we go down, we're all going down together, okay? So we have to make it work, okay? Yeah, so you also make sure that people feel confident in themselves.
Yes.
You don't make them, even though they may not have experience doing certain things, when they go to do it, if they bring me along, I say, of course you can do it. But how can you do it? No, I want you to do it. You go like this, let's practice outside the room, you know? So you build in them that confidence, and you make them be able to feel like this is easy, you know. And then we come out of the room and they say, oh my, how I was so worried and all that for nothing. So you make people realize that they can do it. Even the hardest task is doable. So the other thing is, just like that lady saw potential in me 15 years ago, because I've done this for a little bit, I see a lot of potential, especially in new grads that come to the floor. You know, they're very intelligent, but they're timid. They're not sure because they don't have the experience. So you tap on that intelligence. You make sure they feel like they're smart and they know what they're doing and they're going to be good at it. So I encourage nurses in particular to further their education. I encourage them to go back to school, get their bachelor's degree, get their master's degree, also get certification. For the nurses on the floor, I tell them, go get your orthopedic certification. I tell them, if you can handle this ortho patient this well, you can be a certified orthopedic nurse. Also, sometimes nurses that come to the floor, the oncology nurses that get floated, I tell them, listen, you can get your certification, you can get more money, and you can also get more knowledge. So I think just being very encouraging and being not fearful, you know, sometimes we think when you have enough information, you can kind of look down on people or whatever they say doesn't make much sense. But I think even when you get asked a really dumb question, just keep a straight face, smile and encourage, and always use that as an opportunity to teach. So I think everybody should be encouraged to be their best, even when there's that sense of doubt. I think everybody should be encouraged to actually do the best they can every day at what they do.
Wonderful. It sounds like you're not only a servant leader, an excellent servant leader, but I'm sure that most of your nurses look up to you as their role model.
Just like I look up to them.
Yes.
Yes.
And you make them really feel confident, and as you said, make them live up to their full potential. Wonderful. Thank you, Ms. Cabo, for this interview. Thank you for allowing me to interview you.
You're very welcome.
Yes, wonderful.
I was glad to be a part of it.
Yes.